Good morning. This is Shireen. I am the founder of Evolve 180 Weight Loss, and I'm coming to you this morning. It's April 2nd. It's 6:30 in the morning, and I'm still in my PJs, and this might be a little bit raw, but I just wanted to share some thoughts about what's happening in our world right now and some strategies that I and my colleagues and my favorite gurus of mental health use to stay sane during really tough times. So, as everybody knows, we're in Washington State in the middle of a stay-at-home order during the coronavirus pandemic. And things are a little crazy. Most businesses are shut down to a very large extent. The only places you can go are grocery stores and maybe to get gas for your car. And some people can still go to work for essential businesses, but most people are staying at home. Schools are closed. The kids are there. And it's just a little weird to exist at this time with so much going on around us and so much going on inside our own lives, so much uncertainty. And so what I wanted to talk about today is how to stay mentally healthy during a time when things seem really crazy. And it's not easy. I have been studying my whole adult life, ways to manage my thoughts and emotions. I'm someone who has definitely had lifelong struggles with anxiety and depression. I've been through a lot of therapy of many different kinds. I've used a lot of the work of people in the mental health fields, personal growth fields, to try to figure out how to manage my own internal state during normal life, much less a crisis. It's hard, especially if you tend to struggle with anxiety and depression like me, but it's hard for somebody who doesn't struggle with that to just be in such a crisis and know what to do with themselves emotionally and mentally, basically. And so, given that that's so normal and so common to so many of us right now, I'm just going to share a few of the things that have helped me, are helping me right now, have helped me in the past, and I hope it's useful. I know that one of the things that happens for our clients and probably everybody is if you're at all prone to comfort eating and stress eating, this is the time. I mean, I can't tell you how many people I've heard from, how many of our clients that we've heard from who just are struggling. They might have been in the middle of a really successful weight loss journey. They might have been considering starting one, or they might be in maintenance and trying to maintain the amazing progress that they made losing weight and getting healthy. And it's so universal that people are finding themselves standing in front of their pantry or the refrigerator looking for something to alleviate some stress or even boredom, anxiety. There's no two ways about it. Certain foods, usually carbohydrates, especially high fat mixed with high carb, any kinds of crackers and cookies and cakes and ice cream and even food like, pasta with sauces and mashed potatoes and all kinds of things, fast foods, delivery, all of that stuff is going to have a chemical makeup inside of itself that actually gives our bodies a rush of endorphins and a rush of feel-good chemicals that temporarily really actually do relieve our symptoms of anxiety and depression. We get a little boost. So it's hard to deny that those foods can act like a drug and give us a temporary moment of feeling good. And for some of us, we're so stressed and it's so hard that even a temporary moment sounds like it's worth it because of what we're feeling and what we're struggling with. And so some of what I've done throughout my life, again, not only having these stress and anxiety disorders, but also an eating disorder of compulsive overeating and being really prone to stress and anxiety eating, I've had to really think about this stuff a lot. And I'm sometimes better at it than others, but it's really up for me and for everybody right now what to do. So part of my advice here is about what to understand about what's going on inside yourself, so you can maybe navigate stress eating and your feelings and urges of wanting to do that, and kind of what to do instead. So first I want to start off a little bit talking about, what can go wrong at a time like this. I imagine most of the people listening right now went through 9/11, and at least, were adults during 9/11 and had it impact their lives in pretty significant ways. It's the only thing I can find mentally in my memory to compare with what it's like to live in these times, where there was an event. 9/11 was so much more sudden. This one's unfolding so slowly, like a slow train wreck. But it altered our country. It altered the world, but our country most particularly, and the way for a little while that we did everything. The stock market, the health of our life savings, the health of our job or our businesses. We feared for our safety because of it was a terrorist act. I don't need to tell you. If you remember it, you know what I'm talking about. For me, it's the closest thing. And I keep thinking about 9/11, partly to comfort myself that, yes, it was a terrible event. Yes, it changed our country. It devastated our economy. There were so many pieces of fallout from it, but we did recover. And in some ways, they being the news and the people that I follow, think we're going to be able to recover in ways that are importantly better and different than that event, because we learned a lot from that event, and then later from the crash of 2008, and how to help our economy and everything recover. But there was still a lot of psychological stuff that most of us had to handle, being in an environment where we felt terrorized. And this virus feels like a terrorist. There's so many uncertainties about it and about how it can affect people. The fact that it can be anywhere from asymptomatic to completely deadly, depending on what you have going on. There's a lot of statistics being thrown around, but I don't know about you. Statistics barely help, because I think it's human to feel either too confident, like the statistics mean it's not going to happen to me. And so, because it's rare for maybe my age group or my health group to get impacted. So it can make people too confident and maybe acting in ways that aren't as cautious as they need to, or it can make people feel like they're going to be the one that lightning's going to strike. They're going to get corona. Somebody they love is going to get corona, and just getting it isn't the part people are usually scared about, because it's really the possibility that they or their loved one will be the statistic that gets hit hardest and perhaps has long-term health consequences or dies. So we have fear, and we don't know where it might strike. We don't know if it's going to be touching a cart at the grocery store where we have to go to get food. We don't know if it's touching the nozzle at the gas station where we have to go to get gas. If it's going to be our neighbor who stands and talks to us at the mailbox out in front of our house. If our kids are somehow going to be not paying attention and get that virus and bring it into our family. And I don't know, it's really frightening when we think about our personal health. So the first thing we're dealing with is, a lot of us, is uncertainty and fear of our mortality and the mortality of the people we love. And how realistic is it? We don't really know. And that's part of the problem, the unknowns of the actual risk and how it's transmitted and how to protect ourselves. That's terrifying. We just don't know. Another thing that can be happening right now is bad news overload. I think that one of the things that's great about our technologically connected world now, that wasn't even so much prevalent in 2000, in 9/11, was just the fact that we've got instant news and instant connectedness at our fingertips all the time. And I don't know about you, but God, I feel like if I'm not careful, I can lose myself in hours of scrolling through the news because it feels like there's so much to know, so much to try to investigate. I am somebody who likes to try to get my arms around a problem and understand it. And that helps me feel in control. Like if I know more, then I feel like I can protect myself and my family better. I feel like I can deliver better information to our clients and our colleagues and help everybody, navigate this. And so I'll find myself submerged in news and information and it's not always a good thing. Because news, one of the tricky things about news is, you know, whether you think, whatever your political viewpoints, we've got to all understand that news is a commodity, and there's a competition among producers of news and information to grab our attention and to get our eyeballs. And to do that, a lot of it is sensationalized. A lot of it grabs the most terrifying bits, spins and magnifies them out of proportion. And not like that's needed right now. I mean, it's all scary enough, but there's a lot of stuff I run across where, for instance, a headline is this person predicts the housing market's going to crash in April. And then you read the data that it's based on, and that's not what the data necessarily says. Somebody could maybe make a leap to that, and the expert that they quoted didn't really even say that at all. The headlines grab us, and they play on our fear, they play on our worry, or our desire to know and control the information and the feelings. And then we'll be lost and we'll be scrolling. That's the other thing, is there's like endless scrolling sections of news about local and national and world. And the common denominator between all of it is stress. None of it's good right now. A little bit of it's hopeful, but even that, none of it is, I guess what I want to say is too much of it turns it from a helpful thing where you just know what's going on in the world to some extent to a bad thing. And then the other question is, do you really know what's going on in the world? Because not all the reporting is really accurate. There's information's changing moment to moment. And so we'll talk a little bit more about how to handle news in a second. The other thing that can happen is just a feeling of helplessness. My analogy of a slow motion train wreck keeps coming back to mind because, what it feels like to me and a lot of the people I talk about is it's just being benched. The world's burning and the best thing we can do is stay at home and flatten the curve. And intellectually it makes sense. But it doesn't feel very good. It feels kind of impotent and sidelined. It's hard. And watch or listen or read the news and know that there are people out there struggling. Our healthcare workers, our healthcare system is struggling. There's not enough supplies to go around. We get a introduction to what's happening at the governmental level and how they're responding, and whether they're doing a good job or a bad job just depends on your perspective and what you read. And there's no denying that there's huge impacts to our local, state, national, world community. And there's something so disempowering about being told the main thing you can do about this is to stay home. And especially when, just as a species, we're designed to be connected and to belong. And the first thing we want is to be with our people during times like this. And it's so instinct for a lot of us to have to wall ourselves off, even from our extended family, certainly from our older relatives and friends. And that feeling of helplessness of this is all I get to do about it. It fuels that feeling of anxiety, and it can emphasize or magnify depression. It can just yield its own whole little crisis of thought clusters of, what does it mean? What might it mean? So helplessness and just, being benched while this is all happening is kind of terrifying. And I would say, what 99% of us who are living right now, or maybe it's 95. I don't know the statistics today, but that's the case for most of us. The people who are in the midst of actually dealing with an infection for themselves or a family member are low, but the rest of us are dealing with a different kind of impact. The helplessness happens while we watch our jobs go away and we watch our businesses struggle. We watch our friends in business struggle. We watch our restaurants close. We watch, the we turn on Netflix and Amazon and watch how slow it's going. I mean, we just wonder, we go to the store, there's no toilet paper. There's so many impacts to our lives, and we're basically having to just go home and sort of stew in it, sort of think about what's happening, try to figure out what's happening. It's hard. I mean, there's just nothing like this that I've ever been through, that most of us have ever been through. This is one of the hardest things to go through in a variety of ways. So those are some of the things that I'm finding myself struggling with. And then the final thing I want to mention that's been really hard for me, and I don't know if you guys have been feeling any of this too. The closest thing I can come to describing, this series of thoughts as a group is survivor guilt, where I kind of look at this situation as it appears to be unfolding in the world, and then I feel all this sadness and grief and sorrow and empathy for the people going through this, not just the people catching the disease or dying from the disease, but the healthcare workers, trying to help the people who are sick, and the people, first responders who are trying to help coordinate efforts of getting people where they need to be, the government systems, the business systems that are all struggling, trying to figure out how to survive and help, and the people who must be just so overburdened trying to, find supplies they need. So, I mean, I look at all of these stressors out in the world that people are going through. It's so horrible. And for the people who are in those situations, it's so much harder than for others. For me as a business owner, the beyond a direct impact of the virus on me or somebody I care about, the biggest challenge is my business, and how much it's changed, being basically shut down, and not able to serve people or connect with people the way that we want to. I mean, we're staying open and we're helping people remotely, which is great. I love to be able to stay connected at all, but we're suffering the same impacts as everyone, in that everybody's staying at home and nobody really is going about normal life. So it's kind of terrifying. And I guess what I'm trying to say is, at the same time as I watch all that happen, I sit in my wonderful house with my gorgeous family, and they're all healthy and I'm healthy. My pets are here, they're healthy. We have heat, we have water, we have entertainment and TV and games and all kinds of stuff. There's a part of me that wants to take a deep breath and sigh and just feel that I'm okay, which actually can trigger a bit of guilt because there's so many who aren't. I think about, the what's going on, especially in countries where there's really large poorer populations, migrant workers in India, for instance, or the people in the slums of Brazil, or God, just even in New York with the giant surge of cases that they've had where they just don't have enough healthcare capacity to handle it all. And I, at the same time as I have just this tremendous feeling of empathy and want to send, the people who are suffering through that my love. At the same time, I'm okay, and the dissonance between being really okay and in some ways thriving right now in the midst of all of this and knowing what's going on in the world, it's tough. I feel a little guilty for feeling okay, and I don't know if any of the rest of you feel that way, but it's hard. If you're an empathetic person and care about the world, which I believe that all of you listening do. So that's odd. That's an interesting experience too, and we'll talk about that here in a second. So those are the things that can go wrong. I don't mean to, pile on with the bad news, but the truth is there's good news. On the other side of that, part of what's important if you want to stay mentally healthy during a time of crisis is to understand why you might not feel that way and what the underlying causes are that cause you to feel stressed, and what might you be facing in order to realistically address it. So the next part of this is going to be about what I do, what my favorite mental health practitioners and personal growth practitioners do and advise during times like this, and with those very specific types of problems that I listed.